In the assessment of a patient with flashing lights and floaters, we need to determine, is there a PVD or not? Because if there's no PVD, then it's highly unlikely there'll be a tear, which is ultimately what we're trying to detect as a precursor to retinal detachment. And secondly, if there is a PVD, is there any other pathology? What's very important in the assessment of a patient with posterior vitreous detachment is to do a direct assessment of the vitreous gel itself. In order to examine the vitreous optimally and to look at the retina optimally, it makes sense to have a patient that's fully dilated. You also want to have a slit lamp on its brightest setting. So here's a video of a patient who just has vitreous syneresis only. Okay, so there's no PVD. Vitreous syneresis is the extraction of the solid elements from a gel. This is the cause of chronic floaters in most patients. It's important to do what we call dynamic examination, and that's where you get the patient to move the vitreous and to look down and then quickly look straight ahead. The purpose of this is to move any cells or tobacco dust that may have settled in the inferior vitreous into your field of view. To diagnose a posterior vitreous detachment, there needs to be either a vice ring or a visible posterior hyaloid membrane. When PVD occurs, it doesn't occur as an all-in-one phenomenon. In most people, it tends to go through stages. So stage 1 PVD is where you have separation of the vitreous in the perifoveal region, but still attachment of the fovea and the region immediately surrounding that. In most people, you then get separation of the vitreofoveal attachment, and you go into stage 2, which is where it's separated from the posterior pole, but still attached elsewhere, including at the disc. Stage 3, it tends to separate elsewhere, but still remains attached in the peripapillary region, which is the second strongest attachment. And then stage 4 is when you then get separation of that. When people present with sudden onset of floaters and you can determine a posterior hyaloid membrane, it's generally referring to the latter stages. So where the vitreous is now separated from the peripapillary region and can now independently float around. What you're looking for on direct examination is this area here, shown by the cursor. This is the posterior hyaloid membrane. And if you look diagrammatically, you can see that there's vitreous gel anterior to it, and posterior to it is just purely synoretic fluid. What does that look like in real life? Here's a patient. You can see here there's an obvious posterior hyaloid membrane. There's gel anterior to it, and posterior to it is just synoretic fluid that's clear and looks optically empty. See here I'm using the zoom to focus onto the posterior hyaloid membrane, and it typically has this kind of wrinkly, crinkled appearance, represents the areas to which it was attached to on the retina. You've now diagnosed a posterior hyaloid detachment, but you also do need to look for vitreous hemorrhage and for tobacco dust, the surrogate signs that there could be sinister pathology that you need to detect and refer urgently. Sometimes it can take a while for the posterior hyaloid membrane to present itself, especially if it's lying quite posteriorly. And if it is lying quite posteriorly, you do sometimes need to get the patient to really look around, do this dynamic vitreous examination and focus quite posteriorly with your slit lamp in order to see the posterior hyaloid membrane. And I said critically what you're looking for is the absence of any gel posterior to that membrane, which would then indicate that this is indeed the posterior hyaloid membrane and not just a lacuna, where you would then see also gel behind it. Comparing the two side by side, just to make it even more obvious, you can see on the left we have a video of the patient with syneresis only, and on the right a video of the patient with posterior vitreous detachment. You can see they clearly look different. So you can see on this diagram on the right, you can see this wrinkled appearance of the posterior hyaloid membrane. It's clearly optically empty posterior to that.